I'm gonna show you how to inject Skyrizi at home with the Skyrizi on-body injector, or OBI for short. Before you try to inject, you should be shown how to do it correctly by a healthcare professional and read the instructions for use that are folded inside your OBI box. This spells out everything you need to do step by step. This may seem like a long video, but the injection itself takes about 5 minutes once you press that start button. There are also 5 words that will help you remember. All of them begin with the letter P, but I'll talk more about them later. If you have any questions or need additional help with injecting, your nurse ambassador is there for you and trained to help. Just call 1-866-SKYRIZI. Let's talk about getting ready. Here are some things that you're gonna need. 2 alcohol wipes, a cotton ball or gauze pad, I got mine from the local pharmacy, a sharps disposal container, and the instructions for use. Then, take your box of Skyrizi out of the fridge and leave the unopened box out until it warms to room temperature. That takes from 45 to up to 90 minutes. Now that we are ready, take the plastic tray out of the box, wash and dry your hands, and inside the package, you'll find your OBI, a medication cartridge, and the instructions for use. First, we're gonna open this OBI tray. Pull back at the arrow to peel away the white paper that keeps the tray sealed. Next, we need to remove this plastic cover. So you have to find this rounded opening on the top, insert your pointing finger into it and your thumb on the opposite side. Lift off the cover. If you have any questions, just refer to those instructions. They show you exactly what to do. Now, I'll take the OBI out of the box. On the front, you'll see the status light and the start button. Here's the gray door and the medicine window. Turning it around, there's this clear plastic strip, the needle cover with the needle inside, and the adhesive backing. Here are 2 green pull tabs. On the side, here's the latch on the open gray door. You'll notice that I'm holding the OBI by the side. Always be careful not to touch the back of the OBI, the needle cover, or the needle behind it. Now, check to make sure the OBI is undamaged and the gray door at the top is slightly open. Don't close it. If it happens to be closed, just press firmly on the left side right here and swing the door open. Now, let's look at the start button. It can only be pressed once, so be super careful not to press it until you're ready to inject. If the gray start button is pressed before placing it on your body, the OBI can no longer be used and you should call 1-866-SKYRIZI. Now, let's go over how to load the OBI with Skyrizi. Always holding the OBI this way up, swing the gray door all the way to the right and only close it once the pre-filled Skyrizi cartridge is loaded. Put your OBI to the side for now. Carefully remove your Skyrizi cartridge from the plastic tray. You can see the top of the cartridge is larger than the bottom. Through this window, there's a white plunger and the medicine inside the cartridge. And if you spin it, on the cartridge label, there's an expiration date. Be super careful not to twist or remove the top of the cartridge. Make sure the medicine inside looks clear or yellow, and it does. And if it has tiny white or clear particles or even a few bubbles, don't worry, that's normal. If the cartridge looks cracked or broken, don't use it and call your specialty pharmacy. Gently clean the smaller bottom tip of the cartridge with your first alcohol wipe, like this. And once you've cleaned it, you'll want to keep it clean, so take special care not to touch it. Now, load the cartridge, small side first, into the OBI, and firmly push down until you hear a click. Close the door right away so your medicine doesn't dry out by squeezing firmly until you hear it snap shut. Let's talk about how you prepare to inject. I'm going to inject in my right thigh today, but you can inject in your stomach or the front of either thigh. Just make sure it's a firm, flat area of the skin with no clothing in the way. And check the instructions if you need help figuring out where to inject. Now, Clean your injection site with your second alcohol wipe and let it dry. Next, get ready to place the OBI onto your skin. Remember the 2 green pull tabs on the back of the OBI? Being careful not to touch the needle cover or the needle behind it, peel the green tab on the larger cover to expose the adhesive. Next, I'm going to peel the green tab on the smaller cover. This will remove the clear plastic strip, activating the OBI. You'll hear some beeps and the status light on the OBI flashes blue. That tells you that the OBI is ready for use, and the OBI's lights and sounds are starting to guide you through the injection. Once you've pulled the green pull tabs, you've got to place the OBI on your skin. Be sure to proceed to the next step without delay. If you're injecting into your stomach, hold your skin so the surface is firm and flat, at least 2 inches from your belly button. Now, if I sit up straight, I find it keeps my skin from folding. You don't need to pull the skin flat if you're injecting in the front of your thigh though. Place the OBI onto your skin so you can see the blue status light, and run your finger around the adhesive to make sure the OBI really sticks to your skin. Now you're ready to inject. To start, press the start button firmly. You'll hear a click and might feel a needle pinch. That's normal. If the status light flashes red, the OBI isn't working properly. So just call 1-866-Skyrizi. If the OBI is attached to your skin, carefully remove it. You'll hear a second beep, and the status light will now flash green. That means you've started injecting. You'll hear pumping sounds as the OBI delivers the medicine. The light keeps flashing green until your injection is complete and you've gotten the full dose. That may take up to 5 minutes because the OBI is giving you the right amount of medicine at the right pace. Feel free to move around while this is happening, but don't do anything too strenuous. When the injection is done, the OBI alerts you again and it stops automatically. You'll hear a third beep, and the flashing green status light will change to solid green. Now, all that's left is to take off the OBI. Grab the corner of the adhesive to peel the OBI off your skin. Nice and easy. Avoid touching the needle cover or needle on the back of the OBI. Now, once it's removed, you'll hear a few beeps and the status light will turn off completely. Now, check where you've injected. If you see a few small drops of medicine on your skin, that's okay. Press a cotton ball or gauze pad and hold for 10 seconds. Go easy, don't rub. Slight bleeding at the injection site is normal. Check to see that the green light is off and the plunger fills the medicine window from top to bottom, just to make sure you're done. But one last thing. Take the used OBI with the pre-filled Skyrizi cartridge still inside and drop them both into a sharps disposal container like this one. If you don't have a sharps disposal container, you can get one through your nurse ambassador. Let's do a quick recap. Remember the 5 P's as you inject. Prepare to inject by gathering alcohol wipes, gauze pads, or cotton balls, and your sharps disposal container while your Skyrizi is warming up to room temperature outside of the fridge. Wash and dry your hands. Pick the place on your body where you're going to inject. Peel the 2 green pull tabs to reveal the adhesive without touching the needle. Place the OBI onto your skin and make sure you can see that status light. Press and release the gray start button to begin. You'll see a flashing green light, and when the injection is complete, the green light goes solid. I hope you've seen that injecting at home with the OBI is something you can do. The instructions for use are there to guide you through it. Your nurse ambassador is dedicated to helping you learn to inject every step of the way. Connect with them over the phone, in video chat, or in person. With this support, You've got this.